Hey guys, I was asked what laboratory testing is most effective with fibromyalgia. I'm going to answer that question in just a moment.
Dr. Mark Dailey is president and CEO of Birmingham Functional Medicine, founder of Fibromyalgia University, a certified functional medicine practitioner, and a nutritional counselor with advanced education in functional endocrinology, functional blood chemistry, the brain and neurotransmitters, and thyroid function. With over 25 years in clinical practice, he focuses on chronic conditions like fibromyalgia, chronic fatigue syndrome, irritable bowel syndrome, as well as autoimmune conditions. Let me introduce Dr. Mark Dailey.
Advanced laboratory testing in fibromyalgia. Now, when you consider laboratory testing in fibromyalgia or any chronic condition, the purpose from a functional medicine perspective is to find out what the underlying cause is, the root cause of the condition. Now, if you've been diagnosed with fibromyalgia, you probably recognize that the diagnosis in and of itself brought you no closer to getting better. There may have been a number of different medications that were prescribed, Lyrica, Zymbalta, gabapentin for that given diagnosis, but those medications are rarely directed at the actual cause of the problem. The medications are usually directed at the symptoms that you're experiencing with any given chronic condition or disease process. So when we consider laboratory testing in fibromyalgia, we are not trying to come up with or confirm a diagnosis. We're actually digging deeper into your physiology, trying to figure out what's going wrong. Really, what is happening on the inside of you that caused you to be diagnosed with fibromyalgia. So to be sure, there is no shortage of laboratory testing that could be run. To run laboratory testing without a real reason makes no sense at all and can be expensive. So in our functional medicine practice, we try to narrow down the possible underlying causes by using a metabolic assessment form, which is basically a list of symptoms that are laid out in such a way that it points to a specific system of your body that may be involved in the disease process. We also consider like your adrenals, your gastrointestinal system, your thyroid, your immune system, your detoxification pathways, your hormones, your blood sugar. So we're looking at those things for deviations from normal to give us a clue as to what's causing your symptoms or why you've been diagnosed with, say, fibromyalgia. So the metabolic assessment form gives us some vital information that we can use to help our patients during a complete and thorough health history. So before the consultation, which is where the history is taken, we have the metabolic assessment form that we've already looked at. During the consultation, we look at family history, travel history, your personal health history, medications that you've been on or are currently on. We consider potential exposure to mold through questions, environmental toxins, heavy metals. We look at hidden viral infections, food sensitivities, pathogenic bacteria, yeast overgrowth, parasitic infections, and autoimmune diseases. So as you can see, there is really a lot to consider when we talk to our patients. Once we've reviewed this metabolic assessment form and done a deep dive in the health history with our patients, we can now more precisely determine what advanced lab testing will yield the most information. So if during our health history we determine that there may be exposure to mold or heavy metals or environmental toxins, we look closer. We do advanced lab testing looking for those things. We use hair most of the time to look for heavy metals, or we might look at urine to see if there's mold exposure or environmental toxins. And we can literally measure those environmental toxins, which is extremely cool. We use a comprehensive stool analysis to find out exactly what's living in your gut. Hippocrates was known as the father of modern medicine. He said all disease starts in the gut. And I'll tell you the truth, I've seen that be true over and over again. So we look for pathogenic bacteria, which are bad guys. That means their byproducts are toxic, causing you trouble. We look for a deficiency in good bacteria. We may look for candida, which is a fungal overgrowth, parasitic infections, as well as worms. We're also able to see the condition and the function of your gastrointestinal system. If we suspect food sensitivities, and we always do, we can do a blood spot analysis with just a few drops of blood taken from a finger prick. It looks at over 200 different foods, as well as yeast overgrowth and gluten sensitivities. As good and clean as people think their diets are, 95% of the time, people are driving their own condition, at least in part, by the foods that they eat. Now, this test shows us how your immune system responds to the introduction of these foods. When your immune system reacts negatively to the foods that you eat, it often causes a flare-up of your condition. These are known as fibromyalgia flares or fibro flares. If you've gotten irritable bowel syndrome, it causes an IBS flare-up. Or if you have an autoimmune disease, it can aggravate whatever symptoms you normally have with that condition. The scary thing is that if your immune system is in continual overdrive, just kind of like having your car in park with your foot on the gas, it means it's always at a heightened state looking for foreign invaders. And it's only a matter of time until it attacks self-tissue. And this is known as an autoimmune disease. So an autoimmune disease may be rheumatoid arthritis. So your body's attacking the synovial joints. It could be Hashimoto's thyroiditis, which is your body attacking the thyroid gland. It could be MS, which is your body attacking the myelin sheaths of your nerves. So we need to be cognizant of those things. Then there's an organic acid test. Now, the organic acid test helps show things like insulin resistance, which is a blood sugar issue, mitochondrial dysfunction, which has to do with your energy, ketosis or poor carbohydrate metabolism, acid or alkaline imbalances, inborn errors of metabolism, chronic inflammation, gut dysfunction, amino acid deficiencies, which are micronutrients, toxicology, which is toxicity, neurotransmitter imbalances. So a skilled interpreter can use their knowledge of important markers to find the missing pieces in your earlier treatment. This could be environmental toxins, insulin resistance, possibly a genetic condition, and they can help treat you from there. And then there's something called small intestinal bacterial overgrowth, also known as SIBO. The symptoms can be gas and bloating. I've heard it described as a food baby. It can even include diarrhea. So basically what that means is you eat lunch, you eat dinner, and you feel like you're having a baby. You're that uncomfortable. And this condition can be associated with IBS, IBD, which is irritable bowel disease, celiacs, diabetes, fibromyalgia, rosacea, Parkinson's disease, and obesity. Again, there's no shortage of testing that can be done to someone with a chronic condition, but these tests come in very, very handy when the health history and the metabolic assessment form point in a given direction. We may do 3 different tests on a particular patient to determine the underlying cause of their health condition. We may do, for instance, a comprehensive stool analysis, a food sensitivity test, and an organic acid test. So we're literally looking for deviations from normal physiology using your blood, your stool, and your urine. That's like looking at you from 3 completely different angles. So what's the point of the advanced lab testing? To uncover the hidden causes and triggers of your chronic condition. The advanced laboratory testing helps us actually isolate the underlying cause, identifying the real enemy of your health. Once that's done, we can set up a treatment protocol that's based on scientific evidence. So if you think advanced testing might be right for you, we'd be happy to send you a metabolic assessment form, set up a free consultation, and discuss the laboratory testing that may give you the information you need to get well. So if this information has been helpful, please like the video, subscribe to the channel, and reach out to me. If you're struggling with a chronic condition, I really want to help. Guys, thanks so much. God bless you, and have a great day.
Dr. Mark Dailey is the founder of Fibromyalgia University, the president of Birmingham Functional Medicine, creator of Fibromyalgia Heroes, which is a coaching and implementation recovery program. He is a certified functional medicine practitioner, a nutritional counselor, and a doctor of chiropractic. He has advanced education in functional endocrinology, functional blood chemistry, the brain and neurotransmitters, as well as thyroid function.